Welcome to familydoctor.expert. I'm Grant Blashki. Today we're talking about cold sores. Cold sores are extremely annoying for people. As you know, people get a tingling initially, usually in their lips, which develops into little blisters and then scabs up and creates these sort of unsightly looking scabs on the lips, usually for around a week or 10 days. So people are really not too happy about them. Now, a few things to know about it. It's caused by the herpes simplex virus, what we call the HSV type 1, which usually causes this infection on the lips. There's a similar but different virus called HSV2, which usually causes the genital herpes and is different. Important to know, cold sores are not caused by poor hygiene, and the virus is actually very, very common in the community. Just a proportion of people, the virus lives in the nerve endings and decides every now and then to come out and cause this cold sore on the lips. So why does it do that, and what are the precipitants? Well, anything that traumatizes the lip can set it off. So dental work, sunburn, wind, being out in the wind, being run down. Some people get cold sores during the menstrual cycle, premenstrually. So any stress can set off a cold sore. Now, there's a number of things that you need to know about it. When you've got a cold sore, to manage the pain, initially use some ice is a good idea. As soon as you notice the tingling, there's a couple of good treatments that you might consider. There's a topical acyclovir, and there's a number of different brands, so it's a cream, and the quicker you put it on, so it might even be worth keeping some in your bag or your car, the earlier you put it on, as soon as you notice the tingling, the more likely it is that you can knock off that cold sore before it really develops. You should know that there's some tablets which are even more effective called famiclovir. You used to have to get these from your doctor, but they're often available, certainly in Australia, just as an over-the-counter medicine. And the same deal with those. If you take those medications as soon as you notice a cold sore coming up, it can head them off before it starts. Now, a couple of things to know about cold sores. They are potentially catchy from direct touch. So kissing might not be great. Don't recommend oral sex, not a good time for that. If you do touch your lip, make sure you don't that you wash your hands afterwards, and don't touch your eyes. There is a version of the HSV virus that can get in the eyes. The other one to be aware of is some kids, particularly who get eczema. If you touch that, you can get a secondary infection, so that's also not a good idea. You want to try to avoid secondary infection, what we call impetigo. If you've got a cold sore that's just not settling down, it might be worth going to your doctor and getting the doctor to have a look at it, because they might want to do a swab of it if we're not sure about the diagnosis, to check if it's a cold sore and make sure that it's not a bacterial infection, which would need some different antibiotics. So cold sores are one of these sort of annoying, common but very manageable things. They only really become sort of a dangerous issue, I guess, if you're what we call immunocompromised. So if you're one of those people in a special situation, perhaps having chemotherapy, or someone who's got HIV or something like that, then they can be a bit more serious. But generally they're just a short-lived and annoying infection which we can manage fairly effectively. So just to reiterate, cold sores are not to do with poor hygiene. They're to do with the HSV virus coming back down the nerve endings, particularly if there's any stress on the lips or if you run down. There's things you can do to try and prevent it. Worth taking some lysine that's been shown to reduce recurrences. Put some sunblock on your lips if you're out in the sun. Try not to be out in the wind too long. If you're having dental work, it's a bit hard to avoid the trauma on the lips, but the less the better. And you might have some cream or the tablets on hand to take as soon as the virus raises its head. So I wish you well, and all the best from familydoctor.expert.